Hello everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today I shall be speaking about disease related malnutrition and cancer. It is very important to understand what we mean by disease related malnutrition. Disease related malnutrition is defined as a condition that results from the activation of the systemic inflammation by an underlying condition. Now, over here, the underlying condition which I am implying to is cancer. So, what happens is the inflammatory response will cause anorexia, which means loss of appetite. It can also cause a significant loss of body weight, and also there can be an altered body composition as well. Now, when I mean altered body composition, there also could be loss of muscle mass or there could be loss of skeletal muscle mass as well. As we already know that cancer is a chronic inflammatory condition. So what happens is that the tumor itself will release certain inflammatory factors which are going to be have an impact on the brain, the liver, the muscles or even on the fat function. Now, when we look at the brain, what happens is that it is going to cause altered appetite signals to our central nervous system, due to which we experience altered or reduced calorie intake or reduced food intake as well. Next, what we see is muscle. So now, due to various treatments or because of the underlying condition that is cancer itself, the body undergoes so many physiological changes. There is breakdown of nutrients and so many other compounds, and this is called as catabolism. Now, because there is so much catabolism which is happening, this will lead to muscle wasting as well. And because of muscle wasting, we also see that the patients also have a reduced nutritional status, because when the muscle mass is less and when the nutritional status is reduced, this can also have a negative impact on the patients. That is, they can have a high risk of catching infections, or they can also have anorexia, which is loss of appetite, or there can be a reduced quality of life as well. But our goal is to reverse this, and we need to ensure that we help them in improving their quality of life, we help them in improving their nutritional status, and we also help them in reducing the chances of infections by improving their immune. What are the strategies which we need to update in the nutritional care for cancer patients? First of all, it is very important to screen the patients for the nutritional status, especially in the early course of his or her cancer treatment. So, not only in the early course of cancer treatment, we need to also screen for their nutritional status before the treatment actually begins, so that we have that window period wherein we are also going to help them in improving their nutritional intake altogether. It is very important to identify the signs and symptoms of cancer cachexia as early as possible. So there have to be specific biomarkers which need to be assessed to assess the severity of cancer related systemic inflammation. So there are mainly two specific biomarkers which need to be assessed, and that is CRP or C reactive protein, and next is the albumin. Now, anorexia is also being recognized as an early risk indicator for malnutrition. So, inadequate nutritional intake can be confirmed in a patient only if they are not able to eat for a week, or if their nutritional intake has reduced by 60% of the estimated requirements for at least 1 to 2 weeks. So now it is also important to understand what is the energy and the protein requirements which we generally recommend for the patients who have cancer. So energy requirement is 25 to 30 kilocalories per kg body weight, and protein requirement is anywhere from 1.2 to 1.5 grams of protein per day. However, the protein requirements can also increase for those patients who are categorized as severely malnourished or they are undernourished. Now, oral nutrition is going to include a well balanced diet along with a oral nutrition supplement, as for these cancer patients their nutritional requirements double, due to which we need to give them the additional nutrition support as well. This is going to help in the nutritional gaps when the patients are at a nutritional risk. Immunonutrients like omega 3, arginine, or even glutamine are being administered orally or enterally to help also to enhance the immune system, to reduce the inflammation, and also to improve the quality of life. So, to conclude, yes, disease related malnutrition in cancer patients needs to be assessed, and there has to be an early intervention which needs to be done so as we reduce the risk of the nutritional status in these patients, and we can also closely monitor them. Catching this at an early course is very important so that we can also identify which patients need advanced nutritional support. Thank you for watching our video. We at ZenOnco.io are always here to guide and help you through your cancer care journey. So for more assistance, you can surely connect with our cancer coaches on the below mentioned contact number.